Great. All right. Like I said, happy Tuesday to everybody today. Thanks so much for joining our Mobile Market Coalition's monthly webinar series. As I screen share, I will remind you we are here today to talk rural mobile markets. My name is Sam Lev. I'm a program coordinator for, can we see my screen? Melanie, can you nod if you can see my slides? Great. I'm the program coordinator for the Mobile Market Coalition. As we know, as a part of our mission to position mobile markets as equitable solutions for a resilient food system, this monthly webinar series is focused on disseminating great information and best practices, as well as highlighting experienced mobile markets so we can all learn and grow together. I really love getting to kind of learn more about the network and find people with different expertise in different fields because behind the scenes, I get questions on, on every single thing related to running mobile markets. And so this is really a great opportunity to come together and hear from the best of the best in the field about the how, the why we do this work and how we make it really a part of equitable solutions for a resilient food system. Really quickly, looking forward today to hearing from Maribeth and Ivan from Community Food Initiatives in Ohio, as well as Melanie from Virtua Health in New Jersey. I hate doing introductions for folks since they're going to be talking anyway, so I'll let them introduce themselves here in a minute. I wanted to bring up a couple of notes really quickly. We are recording today's presentation. It's going to be sent out to all of you registered. It'll be emailed to you and then posted to the Mobile Market Coalition YouTube page here within a couple of days, as well as the Mobile Market Coalition membership dashboard. Speaking of membership, I think I keep saying this every month, we're in the final stages of opening coalition membership to the public. If you came to the Mobile Market Summit in Arizona this year, you are automatically a member for the calendar year starting after the conference, starting May 1st. If you didn't come and you're interested in membership, stay tuned to our newsletter and social media to find out when we do open membership to the public so you can receive all of our exclusive benefits, resources, and so much more. I'll be keeping an eye on the chat today as I let our experts present. Feel free to put any questions or comments in the chat. I will respond as I'm able while we're presenting here, but we will save questions for and conversation for the end. We're trying to reserve a good 20 minutes or so at the end of this today for Q&A for discussion, so please don't be shy. I've invited our presenting organizations today because both have experience serving largely rural communities. This is a topic that I know many in our network are interested in just through conversation, emails, and the like, evidenced by the fact that over 36% of our 2023 mobile market operator annual survey respondents reported serving rural communities. So over a third of us are working in these communities at least. Serving rural communities certainly comes with its own unique set of questions, opportunities, and challenges. I know this from experience as well. In my past life, we're so lucky also, especially that Melanie with Virtua Health, their mobile market serves both urban and rural communities. And so I'm looking forward to kind of exploring not just how we serve rural communities, but maybe what some of those differences are. I've asked them to share more about their programs, but in the agenda, you'll see a couple of bullets that I've asked them to share as well. Things like what are some of their unique challenges, serving rural communities, some of the most impactful rural-focused partnerships, as well as maybe some rural funding opportunities that any of us might be able to take advantage of if we are looking to deepen or expand into rural communities with our services. I love always hearing who's in the room. And so instead of doing like round table introductions, if you all, as we get started, would please drop in the chat maybe who you are. We see everybody's name. So where you are and maybe whether or not you're currently serving rural communities. It'd be fun to kind of get a gauge of how many of us are doing this actively or kind of looking to expand into this. So I would appreciate dropping that in the chat as we get started. We're going to start with Maribeth and Ivan. So I'm going to stop sharing and I am going to be quiet and let you all take it away.
Thank you so much, Sam. I'm going to try sharing my screen here in a second, but before I do that, I just want to say hello to everybody. Thank you so much for being here today. We are super excited to get to talk to you all and talk with you all. So I hope folks will have questions. As far as how we're going to do this, I'll introduce myself. I'll let Ivan introduce himself. We have a few slides to go through to talk about kind of our market, and then we're going to plan to take just about 10 or 15 minutes for that and have a lot of time at the end for questions and dialogue. So I will start with introducing myself. My name is Maribeth Saleem-Tanner. We are part of an organization called Community Food Initiatives. As Sam mentioned, that's based in Ohio. We're in Southeast Ohio, Appalachian, Ohio, in Athens County. And so our mission overall is fostering communities where everyone has equitable access to healthy local food, and our Veggie Van program is part of that. And my role there is I'm the executive director, and I will hand it over to Ivan to introduce himself.
Hi, everybody. I'm Ivan. I'm the Veggie Van manager at Community Food Initiatives. I've been in this position since it started in May, since it hit the road in May of 2020, and it's been it's been a fun ride. And I'm happy to be here with you all and excited to talk about mobile market work.
Awesome. Thank you, Ivan. All right, this is always the scariest part of every Zoom webinar. I'm going to try and share my screen. Can folks see my slide?
Yes.
Yay! All right, hardest part
Still
of the
see
whole
like a little
webinar.
bit of your like toolbar, but so it's not full screen, but I see your slides.
Awesome. Yes, that I think will work for us as long as it's not too distracting. So I
Works
can
for me.
see, continue seeing Zoom because it doesn't take up the whole screen. All right. So as we mentioned, we're community food initiatives, and we're going to talk about our Veggie Van mobile market program today. Um, the mobile market at CFI has a few things that are specific to kind of our context and our community and our organization. So we do use a flexible pricing or suggested price model, and we've used that since the beginning, as I've mentioned, when it started in 2020. We typically operate only 7 months out of the year. That's fluctuated a little bit on either end, but the reason that we do that is because we stock our van exclusively with local seasonal food. So we are only selling what is produced locally and what is in season. And our goal is to serve towns without easy access to grocery stores or other local food options. And our overall goal is that that location and pricing, increases access in places that otherwise have a lot of different interacting factors of why food access and healthy food access can be challenging. All right, and Ivan and I talked about this. I'm going to kind of lead us through and do a little bit of a high level overview. And Ivan, I'll kind of cue him at a couple points, but he also can just jump in. Ivan, feel free at any point if you want to add something. When we talk about rural, we are in a rural area, and so we really mean small towns. So we are serving 3 communities on a regular basis, and we use the metric of trying to find communities that are 10 miles or more from a farmer's market because we think of our work as equivalent to kind of providing farmer's market access. So the 3 communities that we are serving currently are the village of Gloucester, which has 1,800 residents, the village of Coolville, which has 500 residents, and the city of Nelsonville, which is our big town with 5,000 residents.
Yeah, and then I'll add to that these villages, these towns here by saying that these are while we see the population numbers. One of the unique things about each of these sites is that the city of Nelsonville, for example, we're located on a main thoroughfare that used to be the way that people would get from, some of the outer cities, the outer towns into the capital, Columbus. Of course, new highway, now it's a lot quicker to get to Columbus. But we're on that main thoroughfare, and then the village of Coolville. It really is. We're on a strip where a lot of town members typically drive through, where people drive through to pick up their kids, or buses drive to take kids home. And then the village of Gloucester, we're also on a state highway. So all our locations, we are on a main thoroughfare. Nelsonville was an exception where we were kind of we had to experiment with different places, but one of the things that we found was that, being on a main thoroughfare is very important.
Yeah. All right. So I won't spend a ton of time on this, but one of the things that we really try and keep in mind is that the big pictures of what we're trying to do and all the ways that we make different adjustments and sort of set different priorities is that we're trying to broaden the customer base for local food. And that idea of, as Ivan mentioned, finding locations that are places people drive by and see and are relatively easily accessible, and using that suggested pricing model. So just trying to find all the ways we can make more people feel like local food is for them and accessible to them. We're trying to increase community wellness, and this was one of the big reasons that our partnership with UB was so great, because they had us, like, they worked with us to find ways to measure how providing this access was actually helping people eat more fruits and veggies and healthier food. And that's part of our big goal, to increase wellness. And then we're trying to strengthen the local food system. So we have two main ways that we're purchasing. One is through a local produce auction, which is a site that aggregates produce from small scale growers within about 100-mile radius. And then we're also buying directly from local farms and farmers. So we are trying to take the investment that we can make in the produce that goes out in the veggie van and use that resource directly to support local farms and farmers.
Yeah, and then I did want to add like a sort of a personal sort of thing about our first one of our first goals that I didn't really fully understand until maybe 2 years or three deep into this work, is that uh, I think it's important to take note about inspiring people to see a value in local food. Yeah, for me, it's very easy to, I was a geography major, master student, interested in sustainability, all this talk about local foods, uh, but I do remember a time when, that wasn't a part of my world, and so, for a lot of people that's the case. It's very easy for us to go to, I'm from California and Southern California, and so it's very easy for people to just go to grocery stores and that's, we all know where that produce comes from, or like, the nature of it. But yeah, we really try to use the language local food, and we, at the end of the day, we want people to have access to local food and appreciate and be aware of local food in this part of the US.
Thanks, Ivan. And I think, one piece as we continue on about thinking about what is specific to a rural mobile market, I think sometimes we might assume that folks who are in rural communities, like, I don't know, quote unquote, like naturally have, or just like have a better connection to farms and farmers, but that's not always true. So I think like one thing that we learn and challenge is, like, just because we live in a place with a lot of farms and a lot of gardens, like some of our customers at the veggie van are total local food aficionados, and they're buying some things from us and they're also growing things, or they know the farmers where this stuff comes from. But an equal number, like, don't have that connection to that local food world, except through the veggie van. So it's like, we can't assume just because people live near farms that they know about local food. And that's something that we are thinking about all the time in how we do this work. Couple things, and I'm trying to keep an eye on time. We have a lot of partnerships. CFI is built on partnerships, all of our programs too, and that is something about being in a rural area, right? Like, I think it lends itself to, we're trying to cover a lot of ground, like literally a lot of ground, huge areas, with often not a ton of resources and not a ton of capacity. And so we get really good at figuring out who we can work with. No one's duplicating. I think we are all like, how do we serve all of these needs and work together? And so some key partnerships for the Veggie Van have been through partner nonprofits. AceNet is a local business development organization that has a focus on food ventures. So We rent cooler space and storage space and office space through their incubator. They help promote us. They've given us marketing support. We fundraise together. And Rural Action is also kind of a broad nonprofit that does economic development and environmental protection and local food work. And so we also partner with them, and we'll talk a little bit more about that specific partnership. Our county libraries are amazing. We partner with the libraries to host the Veggie Van in several cases, and they are the community hubs for getting the word out about programs. Our health department helped get the Veggie Van started. We were part of something called the Creating Healthy Communities Coalition, and they helped us put up billboards and do surveys and connect with other local sites. And we also have partners in our local community action agencies who helped us host and find our sites. We partner with our local health systems, so the hospitals and the healthcare providers are really interested in how we can get more healthy food to more people. And they just last week, we partnered with Ivan, went and partnered with a local healthcare system to be at a health fair and bring the Veggie Van with some samples and some information to folks through a local health fair. And then, of course, the University of Buffalo, who is our founding partner in helping us start this project. Ivan, do you want to add anything else about that briefly? No, you're good. Okay. And I think every mobile market probably has partners, but I think we are really thinking about, the library might not be everyone's first thought about who's your best partner for a food market, but in a rural community, like that is functionally the center of town for most places. They know everybody. And so we are so happy to get to work with them.
And then just for fun, the health department, like Maribeth said, Creating Healthy Communities, they helped us design the logo. They put out a logo contest on Facebook, and that's how we got our logo through a Facebook sort of request for artists.
Thank you. I won't spend too long on this, but since these are folks on the call who I think work in this world, just thinking about like, what does this actually look like in practice in a small area like ours? So this is last year because we're still in the middle of this year's season. But you can see, about 3,300 in sales and about 2,700 in costs. So our goal is always to break even or a little better. So we're doing that on our food costs. We had a total of about 1,500 customer visits. And here's where I think also there's something very particular about this rural model partnership. So we have our traditional market, come get a tomato, get an eggplant, get a whatever for your suggested price. But we also partner through Rural Action and some of those healthcare partners that I mentioned. They have essentially free CSAs. They function a little bit like produce prescriptions. Some people might be familiar with, right? Where people have sort of funded opportunities to have a bag of produce throughout the season. And so rather than, us going, for example, to Coolville, where one of the clinics is that does this, and then our partners at Rural Action driving a separate truck full of bags also to Coolville, Ivan is partnering and he's bringing those bags and delivering them to the produce prescription and the buying club is what the CSA is called, the buying club members who have sponsored shares. And so people are also coming in the Veggie Van to pick up their free bags of food. And then we're connecting with those folks and supporting those services. And the Veggie Van becomes a little bit more of a hub. So you can pick up your bag there. You can get recipes. You can get samples. You can get information. And when you look at kind of, overall, we're actually distributing an incredible amount of pounds of food, which is a weird metric for food, but it's the best we got. An incredible amount of pounds of food through that bag program. So it's helping us meet our mission, even though it's a little different than a traditional market model. Just quickly, we've had some ups and downs. As Ivan mentioned, this launched mid-pandemic, which was an interesting time to start anything, but a mobile market outdoors was kind of a great thing and people were really glad for it. And so, we had our biggest year in 2021, which who knows? But the idea that people wanted something that came to them and was outdoors in the height of some of those challenges, that was the service that was really appreciated. Um, and then we've kind of, stayed around that 1,500 mark for the last couple of seasons, and we're hoping to do a little bit more this year. But again, we have these weekly sites. We've kind of gone back and forth between 2 weekly sites and 3 weekly sites. We've done some pop-up markets, trying different communities. But again, sometimes it's hard to do an experiment because we might be driving, 20, 25 miles with our food to get to somewhere to try a pop-up market. And it's like, how many times can you try that before you kind of figure out if it's going to take? So some of those things can be a little bit of a challenge to navigate. All right, so we're coming toward the end here. My goal is to wrap up in the next couple of minutes. So big picture, the things that have worked really well for us, that network of partnerships and having diverse partners, and not just food partners. People really appreciate the veggie van. People really appreciate Ivan. That idea of having a personal connection with shoppers and knowing people and knowing their names, especially in a rural community, is really important. People are excited about seeing what's new and like what's coming, and Ivan sends out an email every week like this week we have corn, and so people like look forward to that and get excited about knowing what's growing and what's available. The idea of being a resource hub. This year we've really been working with more different farmers and bringing in some different kinds of products. So we've had honey, and like I think this week we're actually also sending out some soap, like goat's milk soap, because we have a local farmer who also has that. So it's sort of just connecting people more to farms and food. And we have gotten connected with the USDA through a couple different ways. One is the Appalachian Regional Food Business Center. And I do want to talk a little bit about that if we have a minute after, because that's a resource. I saw Sam, I think, sent out some things about the Business Builder Awards. And that's the program through which that's through. So we can share some more information about that. And then, oh no, suddenly my slides do not want to work, of course. There we go. Challenges, continuing to find sustainable funding. I think that's probably a challenge for a lot of mobile markets. There's a reason that there are not grocery stores in some of these communities, right? It's really hard to like make back your margins on a community of 500 people. So we are always trying to figure out how we continue serving those areas that in some ways are the hardest to serve financially, the travel and the transport and the low numbers. So we're committed to it, but it's a puzzle. Spring and winter, trying to figure out how to extend the season. Ivan has tried a lot of different things, offering meal kits, offering some different resources. But people want to come when there's fresh local things. And so trying to figure out kind of the right length of season and how to supplement that is something we continue thinking about and working on. The produce bags are awesome. And if someone's picking up a bag of free produce, they're probably not going to, sometimes they might buy a couple extra things, but sort of trying to build that customer base while also providing services that are free. Like just a thing we think about a lot and try and figure out how to navigate. And the last two things very specific to the rural part. I'm sure this is true in cities too. I've always lived in pretty rural areas, but as Ivan mentioned, we try and find main thoroughfares and town squares, but sometimes getting, just from your home half a mile away or a mile away to the town square when there's zero public transportation is like still a barrier. So how do we like better leverage the fact that we're mobile? Right now, we're packing everything into a van, we're unpacking it, we're setting up a tent, and we're somewhere for a couple of hours, but it's not a setup that's easy to go from place to place with. So we're trying to figure out being there is better than not being there, but we know there are people outside of that town center area who maybe don't have cars or, who still can't get to us. So we're always trying to think about how to continue to address that transportation challenge in a more comprehensive way. Ivan, anything else that you want to say? Oh, you're muted. Ivan, you are muted and we cannot hear you.
Yeah. Nothing to add to this, but I did see some questions in the chat that I responded to, but I also kind of want to want to build on during the questions. Yeah.
All right. Thank you. And we just included a couple of these really nice quotes from our end of season customer surveys. People really appreciate this market. They're really grateful for it. They feel really connected to it. It's super fun. And sometimes the numbers are hard because we're working in such small quantities and such small communities, but it's really encouraging and rewarding to hear from people what a difference we're making at the family level and community level. So we just wanted to share a couple of these really lovely pieces of feedback that we get. And yeah, and I'm sure this will, we can send our slides along. So if people want to follow up after this too, we have some more information.
Well, thanks so much, Ivan and Maribeth. I'm sure we'll hear from you guys towards the tail end of this presentation, but I loved seeing all the great pictures and hearing some about your services. Thanks so much for sharing. Melanie, I'm going to cue you up here if you want to get your slides ready. I think I already made you a co-host. Melanie, you ready to go? Oh, there she is. I can see your slides, Melanie, but I can't hear you yet.
There we go. How's that?
Great. Take it away.
Technology.
A lot of buttons to press.
So, thank you so much for inviting me to participate in this afternoon. I'm just blown away by the work that Maribeth and Ivan shared, and I'm grateful for the opportunity to share a little bit about what Virtua Health System is doing. So my name is Melanie Ernest. I'm the director for community-based programming and community health engagement for Virtua Hospital Systems. We have 5 full-service hospitals and 2 emergency departments in southern New Jersey. So we serve a large swath of southern New Jersey, and one of our programs is called Eat Well, which is a suite of food as medicine programming, 2 mobile markets and 2 brick and mortar food pharmacy locations, which Maribeth touched on. Produce prescriptions. Our food pharmacy really works with food as medicine with produce prescriptions, which can be redeemed on either of our mobile markets. So our programs work hand in hand. One of the challenges of working in New Jersey, which is dubbed the Garden State, we have more than 750,000 acres of preserved farmland in the state, but every one of our 21 counties is within an urban metropolitan area for the U.S. Census. Which is frustrating a little bit because I grew up on a farm in very southern rural New Jersey, in Cumberland County, right on the Delaware Bay shore, and teeming with fruits and vegetables, and still one of the areas of the greatest food insecurity in the state. So in that vein, Virtua kind of overlaid the needs of the community, which is access to affordable, healthy foods. And transportation is a big issue in New Jersey. At least 6 of our 21 counties have one or no public transportation routes. There aren't any train systems in southern New Jersey. There's one bus route through most of our service area. And it's difficult to get fresh fruits and vegetables in spite of the fact that they're grown all around us. One of the ways that Virtua, our flagship program, was our mobile farmers market, which is open year round, stocked with initially through a partnership with Whole Foods. So we were sourcing from Whole Foods markets to fill our mobile farmers market We did have a spectacular grant from the New Jersey Department of Health to get started. So we were able to set our price points at about 50% or more below regular market value for the goods that are sold. Right now, our price structure is that we sell by the bag instead of by the each, but it's all customer choice. So visitors to our mobile farmers market can choose a small bag for $3, a medium bag for $6, or a large bag, which is any 20 produce items for $9. And if they present with SNAP benefits for payment, it's half price. You can kind of see what our layout is like. The mobile farmers market is refrigerated, so it's easier for us to store additional goods on board. We have a regular route of 10 stops each week with our mobile farmers market. 4 of them are very urban stops in Camden City, and they're less than 2 miles apart. Another 3 are in very rural areas where there's not a grocery store, there's not a farmer's market, there's really very little access to healthful foods in those areas. Those are actually some of our most popular stops. We have people waiting for us to get there. Last year, we were able to distribute nearly 105,000 pounds of fresh fruits and vegetables into the southern New Jersey communities through our mobile markets, which is just, I'm completely blown away by that number. But it is a weird measurement, right? Because pounds of food doesn't really tell the story. We also have a second program, a sister program to our mobile farmers market. It's our mobile grocery store. So Virtua took a New Jersey transit bus that was at the end of its usable life for the transit company. It had roughly 350,000 miles on it when we received it, and we retrofitted that to become a mobile grocery store. With that, we also have 10 regular stops in the community. Again, 4 in Camden City, which is one of the largest food deserts in New Jersey, 4 in very rural communities in the surrounding area. And let me show you what that looked like before we started our retrofitting. Here it is in all its glory, a transit bus. And today, this is what it looks like. So it is literally soup to nuts, everything you could need. You walk into a produce aisle, there's shelf-stable goods, canned goods, refrigerated goods, milk products. It's spectacular for areas where there's not a grocery store available. We do ask our visitors, like, how is our mobile program impacting your life? As influenced by a healthcare system, our goal is to put health top of mind while we're presenting folks with healthful food options at affordable prices. We want to make sure that we're working to increase the amounts of fruits and vegetables that people are consuming, that we're making that we're influencing more healthful decisions when it comes to food, that people are taking away a little bit of knowledge on how to prepare more healthful foods or make better choices to influence and impact long-term health. So we do a little survey with our visitors 3 times a year. And it's skewed, but 100% of our visitors say that they have more access to healthy, affordable foods because they visit us. And it's encouraging to our team to see that we're making positive impacts on people's lives. Our programs are growing exponentially. It's difficult to keep up with the demand for our mobile markets. We launched our mobile grocery store in 2021, And it's grown year over year over year. We're projected this year to be, more than almost 3 times the amount of visitors in 2024 as our year of inception. The challenges of our mobile grocery store program, it's very large. It's a 40-foot transit bus. It's difficult to get it into places. It's difficult to get it out of places. And we need very engaged site partners to host us for both of our programs. So getting people to the bus is more difficult than getting the bus to the areas. We rely very heavily on partnerships within our healthcare system. Our primary care practitioners are prescribing produce for visitors. We partner with the Department of Health. We partner with local and municipal governments to broadcast and encourage people and help with awareness of these programs. And a lot of it in more rural communities is word of mouth. Especially at our mobile farmers market, people will bring their neighbors or they'll tell a friend and they'll come together. And that's really kind of how that's the biggest way that Virtua has been able to grow these programs is just by having consistent staffing. We have a consistent schedule. We're in the same place week over week, month over month, year over year now with the same staff. We have the same, a driver who greets everyone with a smile. We have community health workers who, in addition to offering fruits and vegetables and recipes, nutrition education, we also offer once a month blood pressure screenings and glucose screenings and cholesterol screenings. So we can tie that back to the healthful foods that they're bringing home with them, the recipes that they're making, and just really make this a nice place where people can come and share their ideas, share their concerns, and pick up locally sourced produce at the height of its freshness. I mentioned when we started, we partnered with Whole Foods Market. In the last 3 years, we have developed partnerships with 4 local growers in southern New Jersey. So now we finally achieved our Jersey Fresh designation as a farmer's market. So that means that more than half of our goods are sourced from local farms, which is phenomenal. The health benefit of eating fresh local foods is fantastic, and it feels very good to be able to make that demonstration of healthy eating, of clean eating, and to support local businesses, local growers, and really bring awareness to some folks that they're eating local foods. We do, it's difficult to demonstrate the impact of programs, especially when you're trying to meet so many needs. For us, because we are able to bring dietary counseling and some preventative healthcare screenings, we're able to measure impact beyond pounds of food and tap into Harvard University put out a tool called the Mobile Health Map. So we can demonstrate a return on life years saved and emergency department visits saved, in addition to a return on investment for the healthcare system. We've had a lot of publicity lately around our mobile programs. Iron Chef Jose Garces has ties to southern New Jersey, and he's been very made aware and impressed by our mobile markets, particularly with we had a temporary expansion into Atlantic County. Atlantic City is a food desert, and the outlying, very rural areas of Pleasantville, and excuse me, other areas, Hamilton in Atlantic County, are food deserts as well. And we were able to bring our mobile grocery store to those areas through a grant from the Economic Development Authority. Unfortunately, because New Jersey is, there are pockets of very dense population and then pockets where you won't see your nearest neighbor for miles and miles. Right? We still have that designation as an urban area through the U.S. Census Bureau. So we aren't able to benefit from a lot of USDA funding that would be made available for other rural markets. So we rely very heavily on other sources of funding. Our programs are funded 100% through philanthropy and grants. And having high-profile visitors like Chef Garces really goes a long way to keeping our programs afloat. We are expanding our services in that vein. Because of these grants, we're able to move into a larger vehicle that will allow us to do more in the way of preventative healthcare screenings and nutrition education at our market stops. So we are having 2 new units custom fabricated, and they'll be on the road in 2025. We also partner with some other mobile programs that Virtua has put forward. We partner with a pediatric mobile services program, particularly in rural communities where there maybe isn't easy access to get your children's immunizations or back to school physicals or lead screening. We're out in the community with them twice a week, every Monday and Friday. And we also partner with a mobile health and cancer screening program that's designed to bring those screenings into communities that are outside of the hospital footprint. So, I'm really grateful that we have the ability to serve a variety of communities, and I'm looking forward to the Q&A session. Thank you.
Melanie, thanks so much. I don't know if you've seen the chat. You were getting a lot of love for your buses, for the bus. Everyone's very impressed. There was one quick question, Melanie, and maybe if you wanted to talk just for a minute, just because there were so many people that were enamored with it, if you could talk about the bus for a second. But Ebony just asked quickly if you could explain the 50% off for SNAP purchases. Is that subsidized by the state or somewhere else?
It's a grant through the New Jersey Department of Health where we're able to do that.
Great. Yeah, who built your bus, Melanie? Do you want to share? Did you guys do that in-house?
We did. We partnered with a company in Hamilton, New Jersey, in Atlantic County called Custom Mobile. It was, if you believe it, there are more than 3 miles of wiring in the bus now to support our HVAC and refrigeration and freezers. It looks like a plate of spaghetti in there. It's ridiculous.
That's incredible. Are they doing your new vehicles as well?
They're not. We actually partnered with for the new vehicles. There is a company called Lifeline in Ohio, and they are custom fabricating our new vehicles. They specialize in mobile healthcare vehicles. So they're the ones who they created Virtua's mobile health and cancer screening unit, and it's absolutely gorgeous.
Great. Now is the time, anybody, if you want to drop questions in the chat or unmute if you've got questions for either Melanie or Maribeth and Ivan. Ivan, you had something you want to follow up on?
Yeah, Ebony had asked about our pop-ups, and so you all might have noticed that we stopped doing pop-ups in 2023, and like I had said to Ebony, staffing capacity was a challenge for that. But this year we're still not doing pop-ups. We're sticking to, our 3 weekly sites, but we are doing at least three different sort of grant related projects. One is it's called Rooting for Wellness. It was through the Ohio Department of Healthy Aging, and this allows us for the entirety of summer to connect with seniors in some of the communities that we serve, and then communities outside of that. And so doing cooking workshops, for fun, indoors, outside. The interns are taking care of that, and then also doing a veggie van, but like a giveaway veggie van, so giving away produce to seniors who attend. And then we also have a farmers market promotion program going on where we promote the products of local farmers outside of for example, our Chester Hill produce auction source. And then there's another one related to expanding the veggie van, like on a small scale. So that will allow us to expand to a new site, hopefully by next year. Yeah. So yeah, no pop-ups, but we've got other little projects going on.
Interesting. Thanks, Ivan. Yeah, I know one of the things Mary Beth mentioned that I've been kind of pondering since she said it is, the pop-ups are a great way to explore new communities and try and develop some new sites, but also the commitment level is pretty high to get there, huh? Between the drive and the extra staff time, just simply the distances is something that probably not a lot of folks that serve like densely packed urban communities have to consider, right? If they're just down the street. Steph has a question. When serving in rural communities with lower population density, this is great. Yeah, I was thinking about this too. How do you determine like what is a successful site with some of these kind of less densely populated communities?
For Virtua, a successful stop means that we can see probably with between 15 and 20 visitors in an hour to an hour and a half stop. And it's really, that is scaled based on the population density of the area that we're serving.
I'm glad you touched on that, Melanie, because I haven't done the math on it yet, but that's just kind of thinking about it from like surface level. I think about it. If we're serving 15 to 20 shoppers, visitors at our sites, a town that's a population of 500, if you do the math, you kind of I know there's a difference between urban and rural environments in that respect, and it's an interesting thing to think about.
Yeah, I think the other thing I'd add, and it's a little bit harder to measure to Ivan's point, is like we think about this in all of our programs. It's like, are we filling a access gap? So sometimes it's hard to be like, we're trying to like make those sites viable. Like we're bringing in enough in suggested pricing and donations to pay for the food. And then we are like, fundraising and grant writing for the staff and the time and the gas and the van and when the van breaks and all the other things. We are trying to like do our best to have it be sustainable on food costs. But it's also about, are we serving people that otherwise don't have other options and like increasing access? And sometimes, and to Melanie's point, like sometimes that doesn't look like high numbers. So trying to keep that as a metric internally.
It's a great point, Mary Beth. I think the kind of scale of some of these rural serving communities and some of the interviews I've done have thought about that in the same way. And it's less the focus is less on kind of gross numbers, right? Like quantity, and more on like depths of services for the people that are actually making it there. Thanks for sharing. Ebony asked, and this is a question I was thinking about too, how do we market to these rural communities? What are some of the most effective outreach tools that you all have? Are there differences? I guess this is a good question for Melanie. Are there differences in the way you connect with the urban sites you go to versus the rural ones?
There are some differences. I mean, it's very easy to park a giant bus in the middle of town and have people see it. If we're, in a more urban area, a little more challenging when we're in a rural area. But what we do, we lean very heavily on our social media. We lean very heavily on community health fairs, and what we try to do is engage with a sort of a site champion. So someone who is a regular visitor to the mobile markets who can really spread the word in their community.
It seems someone has
Michelle,
been
I'm gonna
impersonating
put
me,
you on mute real quick because I think we can hear
and
you.
so I can no longer sit idly by.
I lost her.
This also
Okay, go ahead. Sorry.
Sorry, I just lost my train of thought with that.
You were mentioning site champions, right?
Yes. So that really is one of the most effective ways that we engage with with our rural stops. We have had a great relationship building effort with faith communities also. So a lot of the churches or faith communities will have they'll provide transportation to our mobile markets for their own parishioners and neighborhoods.
And then I'll add, and Maribeth, feel free to add, but I like to think that we're doing similar things that other maybe rural urban mobile markets are doing. One of the things is I make sure when I'm there, and the question is this your first time? And if I find out that it's their first time, I try to get them to sign up for the weekly email. That's kind of how I keep connected with people. And then to kind of go more towards the question, I think one of the ways that I'm marketing at these sites is I just really make sure that like the location is where a lot of vehicle traffic is happening. A lot of these communities aren't really walking communities. Maybe once upon a time in the early 1900s, but yeah, I just really Nelsonville was such a challenge because we thought, oh, we're gonna be at the square. The square, in the early 1900s, a lot of people walking by there, but not anymore. Now everyone's in their vehicle, and so let's get on the main road and let's get on a corner. And yeah, I mean that took from 2021 up until this year to kind of finalize in Nelsonville, but our other two sites have been working well.
Thanks, Ivan. Oh, go ahead,
The
Maribeth.
only other thing I'll add that like maybe this is different or maybe it's not, like we put up paper flyers. Ivan usually spends a whole day, like literally driving around to every library, every community center, like I don't know, sometimes funny places to like put up a sign for bars. Like the veggie van flyers go everywhere. So we do like just try and think about where's a place that people might just see this and like tell someone about it.
I think that raises, it kind of gets us to Flo's question here. And so maybe we can spend just like 1 minute kind of talking about this before we wrap up is how do you decide where you guys bring the vehicle, where you set up in these communities? I know Ivan mentioned looking for really high visibility roadways, right? Places where there's a lot of vehicle traffic. I know in my experience serving like some of the small cities that I serve, not rural communities, that was like like a route to failure for me. So we ended up focusing really specifically on places with lots of people that were already inside, whether it was Head Starts or libraries or something like that. And so can you guys speak to kind of how you develop like where and when you're gonna bring your vehicle?
Sam, our model is very similar to what you just mentioned. We go where the people are already. We tried sort of pop-up markets roadside and had not much success with it. So we partner primarily with daycare centers during pickup and drop-off times. We partner with senior centers and community centers. For our mobile grocery store, we partner with affordable housing communities or senior housing communities and faith partners.
Thanks, Melanie.
And on our end, we had community partners already kind of like in mind. This was before my time as well. Like the Coolville Library, because that's a community center in that small town. In Gloucester, there are places that we could partner with, and they would be glad to help us out and offer their space. But Gloucester Memorial Park is very much a place where people they're passing by the main road and they can drive into it, and there's plenty of parking space. Yeah, because otherwise in Gloucester it may have been like Nelsonville, where this is like the downtown area, this is the square, and people are gonna naturally walk by. But that just the geography of places might, you might think partnering with such and such partner is gonna work, but might not be the case. So I say it's a mix of both.
Yeah, and Ivan, you brought up a point of kind of considering the sites you go to, and if you're looking for places with lots of vehicle traffic, you're also considering where you can set up and where people can park too, which may not always be kind of the same consideration for urban communities or places people are kind of coming out of the building at the end of their day or something like that. So I appreciate you mentioning that. We are at time here. I want to say one more time. Oh, Melanie just put a great comment in the chat in response. So have a look at that. Thank you all so much for joining us today. Really appreciate the conversation. Really appreciate Melanie, Maribeth, and Ivan sharing your expertise on how we can all kind of explore serving rural communities either for the first time or doing better than we are currently. This has been really fantastic. By way of follow-up, our next webinar is scheduled for Wednesday the 25th at noon. I'm going to drop a link to register for that in the chat. We're going to talk about alternative currencies. I think I'm going to try and explore kind of some latest developments on Snap Online, as well as getting into WIC and senior farmers market nutrition programs, which I know a lot of mobile markets have challenges with in various states. And then I'm trying to look for someone that can shed some light on these Medicaid OTC cards. So if you all are doing that with your mobile market or know someone who can talk about those, please contact me because I'm looking for a presenter on that next month. As always, if you have any questions, you want to learn more about the coalition, you want to talk mobile markets, if you have an idea for a webinar that we should consider, please do reach out to us at contact@mobilemarketcoalition.org. The link I just dropped is the link for registration for our next webinar in September. I hope to see some of you there. Ebony, I'm holding you to that. Thanks so much. I hope everyone has a good rest of your week, and thanks again for joining us. I'll be sending out the recording for this shortly. Have a great day.
Thank you
Bye,
all.
everybody. Thank you all.